Hi, I'm Jonas from Whole Body Chiro. One of the most severe issues that I tend to see with my clients coming in, particularly with low back pain, is that they feel locked in the movement. They just completely shifted over to the side and they don't know how to move. They can't straighten up. They're struggling to sort of sit down and stand up. I get them to lie down on a table and ask them to flip over to the other side, and they just said, sorry, I forgot how to move. I can't move anymore. So what happens in a scenario like that is that around the spine, you have all these different layers of muscles that control the movement and sense what's going on. So the superficial layers are the prime movers and stabilizers, and they should be relaxed most of the time. And then deep underneath that, you have these small intersegmental muscles that run in between individual bones. And based on how stretched they are, they will tell the brain about the position of that segment. So they should be switched on tight, so you get a crisp, clear picture of where everything is at. When you get an injury, you switch into a overguarded, undersensing state. So the big muscles take over, these small position sensors switches off, and that's why you feel like you don't know how to move anymore, or you feel like you're standing good, but you're actually tilted off to the side because you can't sense what's happening properly. And that's the problem. If that continues more long term, you're very likely to retweak your back over and over again. So you want to get out of that state as quick as you can. So over the years, from seeing lots of different clients, I've sort of picked up on the things that people say have been working well for them. And I've had one or two of these episodes myself and tried it out. So I'm going to run through what I think works the best. And what works is a bit dependent on what the underlying issue is. So you can have issues in your sacroiliac joint or in your facet joints at the back or the discs at the front. So today I'm going to focus on when you have disc issues at the front of the spine. So because it's at the front of the spine, often how you can sort of know that you have a disc issue is that you struggle to bend forward. Bending forward put pressure on the disc and loads it. Other thing that can load it is compressive loading. So like if you're coughing and increase that intra-abdominal pressure, that can aggravate it. You're driving over a speed hump, you have that compressive load that aggravates it. If there's a disc bulge involved, often you get pain radiating down the leg, like sciatic pain. So that's all sign that it's a disc issue. So some exercises you can do to resolve a disc issue, first of all, is to go for a walk. So as you walk, you get that cross movement between the hips and the shoulders. That stimulates these position sensors and help them to start to wake up. As you get more position feedback, the brain gets more confident that we know what's going on here. We can stop the overguarding and you can start to resolve that locked sensation. So frequent walks, 5 to 10 minutes on flat ground, multiple times a day is great. Other things you can do is pop down on all fours, you're non sort of weight bearing. And from here work on arching and rounding your back, cat-cow. And just gently increase the range of movement there. If you're stuck to one side, you can work on sort of side bending as well. Often people say that they feel really stuck even when they're lying in bed. So you can even start with movements there, same sort of thing. From here I can arch my back up off the ground and then contract the abs, push the smaller back into the table here, and then up again and push down. Or rocking from side to side, even like letting the knees fold from one side to the other to start to get that side movement of the hips compared to the shoulders and get some movement in the lower back. Then, particularly if it's a disc bulge, extension backwards can be really helpful. So we said that flexing forward isn't great for discs because it's loading that front part of the spine, but arching back will take pressure off it. And if you have an emerging disc bulge pushing back towards the nerves, it can help to sort of compress that bulge and push it back forward again. So this exercise is called the Mackenzie protocol, or sort of cobra pose. So you're pushing back here. You can hold it for 5 to 10 seconds and then back down and do some reps like that. If you find that helpful, particularly if it's reducing pain shooting down your leg, do it very frequently, like 20 times a day. You can also do something similar standing, like just arching back, or here. So if you're looking at the big picture here, what we're trying to do is stop aggravating it, to avoid things that loads the disc. So sitting, causing that flexion and loading your spine, prolonged period of sitting, avoid that. Bending forward, lifting things, that compressing, loading the disc, avoid that. But try to encourage movement with walking, gentle mobility exercises that stimulate the position sensors, get them back online so you can get out of that panic, cramping mode and start to get some movement again. Because that movement will help to dissipate inflammation, get blood flow to the damaged tissue, and wake up the position sensors so you can move safely again. So try that and good luck.